Let's go to chat. I see some questions here. I'm gonna stop sharing my screen. Oh, thank you for answering, Brandon. Um, does anybody, let me see if people want to, anything you want to share, Brandon, from the chat or from the presentation?
Um, I just I just think that we had a couple of questions that I responded to. One was the question into and I think both Mary's question to how much is this actually drug related and how much is actually therapeutic related. And I can't speak to the exact study Dr. Fatemi was speaking to, but most of these studies they do have therapeutic controls because we're trying to figure out how much is the drug's actually making a difference, and the therapeutic side is very aggressive, and in both groups there's what appears to be a very significant trend and an improvement in scores, but I've never seen, and if one of the other panelists has, like a true control group of no therapy, no drug, and I haven't seen those.
I haven't seen that either. This study that Mary Beth is talking about is Dr. Bott's study in alcohol dependence or alcohol use disorder. So, what they saw, which is really cool, this was a 6-month study. They gave psilocybin to one group at week 4 and then at week 8. And with intense psychotherapy within the first 4 weeks of the study that there was intense psychotherapy, just with psychotherapy itself, both groups decreased in their alcohol consumption by 25%. The Benadryl group kept that 25% throughout until the 6 month was over. The psilocybin group decreased by 80%. So does that answer the question? It is, psychotherapy is absolutely huge.
And then I think, one of the other comments or that I made is we take out the pandemic, but even before the pandemic, it was clear that the life expectancy in the United States was declining. To quote at the time Robert Redford, the CDC director, life expectancy in the United States is declining because of overdose and suicide. And what are we doing to address that? And as a physician, I sometimes feel that it's just too real easy to write a medication, but I'm also very conscious to treat anxiety, depression, first line therapy. Therapeutic intervention is first line treatment. And some people do want medication, and that's fine too, and that's a first line treatment, but we have the option. Nevertheless, I have not seen a major push by anybody to try to increase the number of therapists that and mental health
Yes.
people on a time here a lot. And at least locally, I know a fair number of mental health professionals that are a cash only business. And it's going to self select. But again, I think some of these people who are really struggling that could make some big strides don't have a lot of access. Calling and finding an appointment is a challenge for a
Yeah.
lot of patients as well.
Well, it's very interesting. This is a great topic. In the recent year, there has been a mass exodus of mental health professionals, therapists, and they just can't because it's been so overwhelming with the increase in number of people with all these mental health issues that are coming to them. They're not able to take care of their own mental health, and that's one of the focuses of my work is taking care of the physicians and the healthcare workers first, because we are the nidus of being able to take care of thousands of patients per year if we're working full time. So if we are, in a space that is balanced and centered, then we're able to serve. But that comes with serving ourselves first. But yeah, it's actually the opposite of what we should be seeing, is that people are leaving the field instead of those are some of the things that need to be looked at in healthcare in general. Reimbursement, the fact that maybe creating systems that are friendlier, to the healthcare worker population.
Absolutely.
Yeah, yeah. Let me see.
Do we have some other questions?
Yeah, I think there's evidence that psychotherapy can help people stick to workout routines, improve their it's all so connected. Absolutely. Oh, 100%. 100%. 100%. No, thank you. Thank you for the comments. It's thought provoking. Anything else that is coming up for you guys? Okay, and I will provide my contact information to the group. It's very simple. And I believe we'll be done if you guys don't have any more questions. I think we're done.